Welcome back to another episode of ACR On Air, the official podcast of the American College of Rheumatology. I am your host, Dr. John Hausman. September is Rheumatic Disease Awareness Month, or RDAM, and this year's focus is Rheum Moves, exercise for individuals living with rheumatic diseases. Why exercise? Because movement changes the trajectory of pain and function, and it's still underused in care. We'll get practical in how patients can incorporate exercise into their daily lives, from simple step counts to resistance work that can be done at home. We'll talk about how to start slow and stay consistent. We'll talk about cardiovascular risk in rheumatoid arthritis and how exercise can cut it down. Plus, strategies for fall prevention and how technology and care teams can help set goals that patients will actually meet. Joining us are two experts who live and breathe this stuff. Dr. Adam Good is an epidemiologist and physical therapist with a focus in musculoskeletal epidemiology and health services research. He's professor in orthopedic surgery in the Division of Physical Therapy at Duke University School of Medicine and the president of the Association of Rheumatology Professionals. Also with us is Dr. Linda Lee, professor and Harold Robinson Arthritis Society Chair in Arthritic Diseases in the Department of Physical Therapy at the University of British Columbia. She's also senior scientist at Arthritis Research Canada, where she leads the Arthritis and Implementation Science program. Enjoy. Adam and Linda, welcome to the show.
Hello.
Hello.
So I'm super excited to speak to both of you about RDAM, or Rheumatic Disease Awareness Month, which is every September. And the campaign for this year, it's called Rheum Moves, exercise for individuals living with rheumatic diseases. Adam, can you talk a little bit about sort of the RDAM in general and why exercise was chosen as this year's central theme?
Sure. Thanks, John. As you mentioned, RDAM, Rheumatic Disease Awareness Month, was established back in September 2016. It's part of an initiative the American College of Rheumatology put together. And this year, like you mentioned, the focus is on exercise and physical activity, and also called Rheum Moves, specifically for individuals with rheumatic disease. And part of the initiative was to address some current knowledge gaps that we've identified in patients that have rheumatic conditions. And we know that exercise and physical activity are very important and helpful, but we also know that also not very prevalent or used or utilized by patients, despite the improvements in experience, physical well-being that we know could be part of some of the benefits of physical activity and exercise. So Rheum Moves this year is developed to foster this knowledge and partnership. We hope to empower patients to make a more proactive role in their treatment journey for rheumatic conditions.
I think it's so important because patients often have the misconception that, well, I have arthritis, my joints hurt, so I should not exercise. I should stay away from things that could potentially make me feel worse or move my joints. And I guess what we all know is that, as we say in rheumatology, motion is lotion, and the more you move, better you'll feel. But let's talk a little bit about some of the statistics. I think one of the things that the American College of Rheumatology is trying to disseminate is that patients can have a 40% improvement in function and decreased pain through physical activity. Can you talk a little bit more about that and what that practically means for patients?
I think in a general sense, we know that exercise is underutilized, the physical activity is underutilized. And we know that some patients with rheumatic conditions have more pain, joint pain, and loss of function. And we know that inactivity leads to additional loss of function and pain. So the main goal here is, as we improve movement, we see very dramatic increases in physical activity, or physical function, I should say, and reductions in pain. There are some specific conditions that we have studied and we know that are rheumatic conditions that we've been able to document improvements. So, for example, with osteoarthritis, we've seen improvements in pain, mobility, and function with walking 6,000 steps per day. Those are significant improvements that keep the joints loose, keep them lubricated, as you mentioned, and help improve that function and decrease that pain. There are other conditions such as RA and lupus. I'll ask Linda because I know that she's done some work in this area.
Yeah, no, thanks, Adam. People with rheumatoid arthritis or inflammatory arthritis in general, part of it, well, in addition to the pain and fatigue and stiffness that people experience, that can mitigate it by regular exercise or being physically active. We also know that inflammatory arthritis, like rheumatoid arthritis, is associated with about increase in cardiovascular diseases. And we know that regular physical activity and engage in exercise can reduce the risk of cardiovascular diseases, particularly in people with rheumatoid arthritis, and it reduced up to like 30% decrease in risk of heart diseases. And we also know that being physically active, engaged in aerobic resistance exercise for people with rheumatoid arthritis is linked to reduce in disease activity, in addition to improve their heart health. One thing I do also want to mention is that about 15 to 30% of people with rheumatoid arthritis also have muscle loss, quite a bit of muscle loss. So in rheumatoid arthritis, they call that rheumatoid cachexia. So especially in people with rheumatoid arthritis and as they age, the rheumatoid arthritis disease activity can associate with muscle loss, and that coexists with frailty, and there's a greater risk of falls. So exercise is important because if you do strengthening exercise or resistance exercise, these are the kind of exercise that challenge your muscles and make it build strength and build mass. It helps to improve your ability, your functional ability, and also exercise that improve people's balance is important because we know that it helps to reduce the risk of falls. So being active, do your exercise regularly can be beneficial in so many ways for people with arthritis.
Linda, I'm glad you mentioned falls because one of the hesitancies that some patients have in starting or engaging in physical activity is that they're afraid that they're going to fall, right? They feel like they're unstable. They don't feel like they have good balance. So what strategies would you suggest that we have with patients to try to get them to do those exercises that you think ultimately will benefit and prevent them from falling? In the meantime, that they do it in a safe manner.
It is always a challenge for people to start something new. For people who are starting to build exercise or physical activity as part of their routine, starting slow, going steady, and listen to the body is important, especially with the ebb and flow of the symptoms in arthritis. It is important to go with the flow when you start. So, as Adam mentioned, if someone with osteoarthritis, for example, walking is a fantastic way to start building your physical activity routine. It's not like the first day you have to start going for 6,000 steps or more, but even just start a few minutes a day, making a plan. What time of the day is a good time for you to go out for a walk? Would you like to go with someone to make it a social event? And we know that making it a social activity, making it enjoyable is something that people would tend to stick with as a new routine. So I would suggest that find something that you enjoy, start slow, listen to your body, and make sure that it's fun.
And Adam, how do you think physical therapists can sort of help patients in setting those goals, getting started, and then navigating challenges like fear of falling, fatigue, or pain?
Yeah, I think those are all areas that physical therapists are educated, and having patients with rheumatic conditions discuss that with their physical therapist is a great starting point because the physical therapist is going to be able to examine or know their abilities and current abilities and disease process that would allow them to design a program that would be a good starting point for their physical activity or exercise program and specific to the goals that they may have. And those goals can vary patient to patient, but physical therapists are trained to examine and develop and work with patients to modify those goals as needed.
Yeah, and I think one of the main challenges that I mentioned before is sort of this fear of pain, right? So walking hurts, right? Climbing steps hurts. And yet you want me to walk and climb steps? How do you get them through that hurdle? And how do you coach patients through that process? Because my thinking is ultimately by engaging in physical therapy, the pain will lessen and they'll be better able to participate, climb steps and walk, right? But initially, it may be more uncomfortable for them. So, how do you guide or coach patients through that process?
Yeah, I think education initially and initial education is highly important in working with patients as they start an exercise program, educating them on what to expect after the first session of exercise or physical activity, after a week, what to expect, what you don't want to see after an exercise or during an exercise program is also highly important. Knowing when to progress that exercise is highly important. And those are all key components of establishing that program. I think a lot of times individuals and patients may go out and start an exercise program based upon information that they have read about or seen that may not be specific to their current function. They can overdo it, as you will, where they have increase in symptoms that could prevent them to keep going. And that's why it's so important to establish that early on, where it may be very easy the first few times you start it, but that's important to establish a minimum threshold so that progression can begin. But I think, Linda, what are your thoughts on that?
Yeah, no, you have some really good points, Adam. Go back to the point that I think starting slow, experiencing that success that, you actually finish a session, it feels great. Is start a habit, first of all, and then you can build the intensity, the difficulties of the exercise incrementally to challenge the muscle, to challenge the body. And I think the point that you raise around making sure that individuals are assessed regularly and making progression with their exercise is really important. Part of it is that if the exercise, especially for the type of exercise that helps to strengthen your muscle, if it's not challenging enough, the person is not going to get the benefit, the intended benefit. And also people will get bored. That's the other thing that, people why they started exercising and then they stopped because they got bored. And oftentimes it's because it's no longer challenging. It's just like a routine that you have to do, but it's meaningless. So I think all of those are really important. And for people who may be having a lot of pain, having difficulties to make those few initial steps, or John, like you said, climbing stairs, there are strategies to manage pain and for people to be able to start without substantially increasing the amount of pain. And I think that's why the interprofessional team approach is so important, working closely with rheumatologists in managing pain, working with pharmacists around medication use and when best time for them to start doing exercise is important. Last thing I want to mention is that exercising in swimming pool. So pool exercise program can be quite useful for people with a lot of pain, especially in the knee joint or hip joint. They can do quite a bit more in a more comfortable environment without loading up a very painful joint. So those are the things that people can consider if they have access to.
Linda, you've spoken now a couple of times about sort of resistance exercises. In my mind, that's sort of weightlifting. So, do you need to go to a gym and have access to a gym to do like resistance training, or are there other ways that patients can do resistance exercises at home that you would recommend?
The short answer is that no, you don't have to go somewhere or buy an expensive piece of equipment to do resistance exercise. I mean, people hear the term resistance exercise, muscle strengthening, strength training type of exercises. And all it means is that you put you put weight to load up the muscle. So you can use your body weight
Hmm.
when you're doing strengthening exercises, especially for lower body exercise or what we call core exercise. So your abdominal muscle, your gluteus muscle, some of those exercises, you can actually use your own body weight, the way to perform your strengthening exercise. And that's where physical therapists and exercise professional, their role is so important because they can help to do proper assessment and prescribe how to do those exercises and in what intensity that's tailored to the individual's ability and their needs.
Yeah. And you also mentioned sort of the importance of fall prevention. So, what types of activities do physical therapists recommend in an elderly patient that you might be afraid would fall during exercise? What are you working on? I imagine that's resistance training is part of it.
Yes, indeed. The three types of things that for falls prevention, that three types of exercise that individuals may want to focus on. Actually, two exercises and one physical activity. So in terms of more structure, tailored type of exercises, strength training, resistance exercises, especially for people who are at a higher risk of falls and their balance is a little bit more challenged. Some of the exercises should be done in a seated position or holding on to something stable, like a counter, kitchen counter, for example, to perform those exercises. And as people's muscles get stronger, their balance get better. They don't have to have much support or can do it in a standing position. So, of course, strength training, balance exercises are another type of category that is important. And then walking. Don't discount the power of walking 2, 3 times a week and make it intentional. Those are really the core component of exercises that helps in falls prevention. And there are structured exercise programs that are evidence-based for falls prevention as well. And one of them that it's really well known is called the Otago Exercise Program, which is quite often used for older adults, even for individuals who are quite frail. There are exercises that physical therapists can prescribe based on their assessment and tailored to the individual's ability.
Amazing. And Linda, you made a distinction between exercise and physical activity. Can you talk a little bit more about those? Because in my head, sort of those are kind of similar.
Yeah, no, we oftentimes get asked that question. Physical activity is this broad categories. It's really any movement that is powered by your skeletal muscle. Your body make those movements. And it involves some energy expenditure. So it's not just moving quietly when you're in the seated position, but you're actually moving with energy being used. So exercise is a very specific type of physical activity. So there are usually designed or developed to achieve specific goals or therapeutic target. So, for example, flexibility exercises are designed to increase individuals' flexibility, their movement. Aerobic exercises primarily helps to work our heart and lung capacity. And strengthening exercises or resistance exercises are the ones that work our muscles. So they're sort of used sometimes interchangeably. You're not supposed to, but they are exercise is really a subset of physical activity.
Got it. Many patients, I ask them, do you exercise? They say no, but maybe they're like housekeepers and they
Mhm.
spend all day making beds, going up and down the stairs and cleaning and things like that. So does that count? Should that count as, I guess that is physical activity. It may not necessarily be exercise. Is that good for patients to do that?
Yeah, well, that's a loaded question. So, being physically active is a good thing. And a lot of the physical activities we accumulate throughout the day are related to our daily activities, related to our occupation, what we do, even commuting to work. I mean, when you're walking, when you're traveling, those are activities, physical activities that we do. So when you look at physical activities at a continuum, right? So the current guideline talks about you need 150 minutes of
Mm.
moderate to vigorous level physical activity. And that's sort of the level of activities that people will, may get a little bit out of breath. They may sweat a little bit when they were doing, but then there are also lower level of activities like light activities. So you're not seated, but you're doing work when you're standing or when you're walking slowly. So examples like when you're doing housekeeping, activity, chores, when you're getting groceries, you're not rushing, or I'm not rushing really quickly, so it wouldn't categorize as fit the moderate, vigorous physical activity level. But the light activities also, it has its own health benefit. However, if the individual is needing specific things that they can do to increase the flexibility of their joint, to build muscle in specific area, and though they will need to have a program that's specifically with the type of exercise that meet their needs. So I would not say that one doing a lot of physical activities in their everyday activities can replace doing some of the more targeted type of exercise that is specifically to meet a certain target. I would be interested in Adam's thoughts on that.
I completely agree. I think depending on the goals that a patient may have, there may be specific things during the day that they do as a routine job, if you will, that wouldn't target muscles that are needed to build strength and endurance that are sustained long enough during those activities. It's not to say that if they were to stop doing those activities, for example, their chores or things like cleaning during the day, their symptoms maybe get worse because they're not moving as much.
Hmm.
But in order to make improvements beyond what their current status is, they would probably need to have more targeted intervention or exercise to strengthen those muscles or increase endurance, as Linda mentioned, about sustained activity that is moderate to vigorous.
And Adam, do you have any idea? We started this podcast saying how important exercise is and the benefits of exercise, especially for people with rheumatic diseases. But do we have any idea what percentage of patients with arthritis actually engage in enough exercise to meet sort of the current guidelines, like Linda mentioned, 150 minutes a week?
It's lower than what I thought it would be. It's only around 35% of adults with arthritis meet the aerobic activity guidelines. And it's not unexpected because arthritis is painful. And when we have pain, we don't want to move. We think it's going to make it worse. And that's a big barrier of participating in aerobic activity guidelines. There's also the ideas around if you have pain to begin with and you start a program where you get to being physically active and you feel a little bit worse because it was a little bit more than what you anticipated or started a little bit too high of intensity, then there's a high chance you're not going to be successful at that program. That's why having those key elements in collaboration with the interprofessional team is so important, as we've mentioned earlier. And there's also other barriers. I think knowing where to start is a very key area for patients. Knowing what modes of exercise, the type of exercise that can be beneficial. I know we've mentioned walking and Linda mentioned aerobic water activities. There's others, there's cycling, there's other types of activities that may be less weight bearing or less stress on or load on the lower extremities if it's, for example, knee osteoarthritis. So those types of barriers are very important because the goal isn't that you start, it's that you maintain and you progress. And a very key component of that is starting slow and knowing how to progress. And that's not just for patients with rheumatic diseases. I mean, that's for anybody. There's a low success rate because people just don't know how to get started. They don't know how to progress. We have folks that progress too quickly and get burnt out on it. And that's very common. It's very similar with rheumatic patients. And that's the key, is that interprofessional education.
Fascinating. Linda, I wonder what your thoughts are about technology. Nowadays, we have rings and watches and all of these things that supposedly help us to promote physical activity, as you mentioned, and get like the 6,000 steps per day. What are your thoughts of these technologies? Are they helping? Are they hurting? And I know you've done some research in this field.
Yeah, no, I think one of the major advances in promoting physical activity is the introduction of some of these technologies that used to be really, really expensive, and now the cost come down a little bit. Some of them still expensive, but technologies like fitness trackers, you said smart watches, rings, and even some of the mobile apps that many of us have on our mobile phones, they're pretty good in helping people to build healthy behaviors. And certainly some of our work in people with osteoarthritis and rheumatoid arthritis and lupus have found that it helps to improve physical activity participation in the short term, at least. They are useful because it sort of give people an idea about their activity pattern. In some of them, they track your 24-hour sort of activities. So how much time you spend in moving, resting, or sleeping, which is another component that is important in our 24-hour day, right? If you don't sleep well, you don't sleep long enough, your symptoms just get amplified oftentimes when you're trying to be physically active. So those type of devices also use what we call behavior change techniques to nudge, encourage, promote physical activity. It helps people to set goals, for example. It helps people to monitor and give people feedback. Those beeps and little vibration or a little graphics that comes out. I mean, it's amazing that people find it very motivating and they will go the extra steps, so to speak, to achieve those goals. So some of those apps are really useful. And the others that also help people to track symptoms and disease activity. One of our projects, we just sort of developed a prototype app for people to track their rheumatoid arthritis symptoms and disease activities, and also allow people to upload their physical activity tracker data so that people can see the connection between what they're doing and how they're feeling. So in general, people find that they learn a lot more about what is their norm in a day. So not only that they help to promote or encourage them to be more physically active, but also they can get a sense of what is a good day or bad days that is out of their normal range that they may need to seek care sooner than planned. Those are useful, like in terms of helping people to be more self-aware, motivate them to be more physically active, and also give some guidance for their interaction with health professionals as well. One thing I want to mention is that when you look at the evidence around using these type of devices, including someone who knows arthritis, a physical therapist, exercise coach is important because it helps to give that extra guidance, extra feedback that can help to optimize the effectiveness of people engaging in physical activity.
That's fascinating because many patients are wearing these devices, and not necessarily because they want to track their health, but because, they want an Apple Watch because they can communicate with other people. But I hardly ever look at that data. And I'm sure there's a lot of great, if I were able to understand their data, I may be able to understand their disease a little bit better. I wonder, do you guys look at a patient's like iPhone or smartwatch data to help them either create a program or review how they've been doing after you set a program? Is that something that you'll look at?
Adam, would you like to go first?
Yeah, I think that those devices are, like Linda mentioned, are a powerful way to motivate and track. And I have had patients in the past who have asked questions because some of those devices, like you mentioned, Apple Watch, will automatically give you updates during the day of how many steps you've taken. And I think that's a powerful message that can be helpful if individuals, patients know what the goals are and what is recommended for them. And it helps us to understand if we're getting closer to those goals because it'll track and show you your trends over time. And some of those devices will even give you updates on your trends. I know I pay attention to it. I do tell folks about those updates and how useful they can be with understanding something as simple as steps. But steps are very powerful, as we mentioned, in understanding our physical activity, our daily physical activity and trends over time.
Yeah, no, and I think how health professionals are using those type of data with their patients is still evolving. We did some work about 5 years ago. One of my PhD students, Dr. Jenny Lees, did some interviews with patients who in randomized trials using these type of devices and with counseling with physical therapists. And it was fascinating that patients talk about how the relationship with their health professional changes. Some felt that it helps to get more useful feedback from their health professional. They will make sure that individuals, when they're in their therapy sessions, that they make sure to share that information with their physical therapist, with their health professionals, and get some feedback. And in terms of behavioral techniques, it's really powerful that when you get
Hmm.
the feedback from someone external, rather than just looking at your watch and get that watch to give you the feedback. But others would feel that, well, being watched, right? And like I have to be accountable, and like I'm doing my physical activities, not or exercise, not for me, but I'm doing it for my therapist. So it's an evolving dance in terms of how we use these type of data in our clinical practices. And I would say that health professionals, rheumatologists, therapists who are trained, graduate more recently, they're probably more comfortable in using some of those data with their patients, or actively asking people, are you tracking? Is there something that you want to share with me? And use that information to inform their counseling, their education approaches, and exercise prescription.
Yeah, great. Two things that stuck with me is that having a third party be aware of your data makes that sort of more valuable and makes you more accountable. And also having that third party help you to set goals, right? So that you know what it is that you're trying to achieve, not just tracking for the sake of tracking. I think those two things are quite powerful. Adam, can you talk a little bit more about sort of what resources the ACR has for patients who listen to this podcast and now they really want to try to exercise, or how to get started? What sort of resources are available?
Yeah, so as we mentioned, this year's RDAM is about Rheum. So it's about exercise for patients with rheumatic diseases. Part of that campaign, we've put together an infographic that has some PT approved exercise tips. We've also put together a library of exercise videos that have some exercises through some reputable resources that will allow patients to view particular exercises. We have some downloadable social media graphics, as well as some fact sheets on exercise and rheumatic disease. So, all of those are available resources that ACR and ARP have put together to help patients and providers, professionals, to educate and prescribe exercise for patients with rheumatic disease.
Sort of in an ideal world, how would you envision that rheumatologists and physical therapists work together to encourage their patients to exercise so that everybody is on the same page and that the patients have sort of like a guide going forward? What's the best approach?
Yeah, I think that some of these resources can provide an avenue of communication for providers to communicate with each other and also for patients to communicate with providers. And for rheumatologists and physical therapists, I think it's important that, especially for patients that have some joint damage, that there needs to be a very slow and easy progression of exercise, that there's communication between the rheumatologist and the physical therapist about the patient is starting this program, and there'll be some monitoring and there'll be some communication with the patient about progression. So I think that's incredibly important, is one, the communication between the rheumatologist and the physical therapist as patients begin those exercise programs. And I think using some of these resources that I mentioned before to help patients communicate and become aware of exercise, that they can go back to the physical therapist and rheumatologist and ask questions.
Mm.
And taking a look at those resources that we put together, developing some ideas around an exercise program that they may be interested in, and then getting some of that feedback from both the rheumatologist and physical therapist, and some guidance and goals, the goal development that they can put together, and really understanding how exercise is going to improve their disease process and improve their function and reduce their pain is very important.
Linda, I wonder if you have some tips. If I'm a patient, I love what I'm hearing here. What are a couple of things that I can do today to sort of get started in this exercise journey?
Yeah. I go back to start with something that is feasible, is comfortable. Remember, moving is better than not moving. Don't feel that you have to, like, if you don't have 30 minutes to do your exercise or physical activity, then just like forget about it. moving is good. And also start with something that you have in your environment. So again, make a plan, but don't make a plan to go buy a lot of equipment and things before you start. I would also like to highlight there are really good programs that help to guide people to start developing routines, such as I know of the Walk with Ease program, quite useful and a resource that is accessible online is a structured program that can guide people to start if you have not been exercising regularly or go out for a walk regularly. Like those are the resources that are useful to get you think through what is the best way for you to start and continue. So those are some of the things that come to mind.
Great. Adam, any your thoughts about people that just want to get started now?
Like I mentioned before, utilizing some of those resources we put together, I think what Linda mentioned is right on with starting with something that they are familiar with, something that they have access to immediately, something because consistency is key here. It's not that there's a need to go out and get a lot of different equipment in order to do what is needed here, which is starting slow, knowing how to progress, learning how to progress, and doing something that they will enjoy and becoming familiar with that. I think that those are really key elements to maintain consistency over time because it does take a little bit of time to see some of the results from a program. And that means that we want individuals to be consistently doing those types of activities in order to see those outcomes.
Great. Wonderful. And we'll have all of those resources attached to the notes for today's podcast. So for anybody listening, if you go to the notes, then we'll have all the links to the ACR website, the RDAM website, and all the other websites that are mentioned here. Linda and Adam, thank you so much for your time. This has been a wonderful conversation. I'm excited to exercise myself. I think after this, I'm going to go to the pool and do a little bit of swimming. Thank you both for your time.
Wonderful. Thank you.
Thank you.
Well, there you go. Start slow, enjoy what you choose, and progress with guidance. 6,000 steps isn't a finish line, it's just a nudge to get moving. Resistance training protects against rheumatoid cachexia and falls. And technology can motivate, but the real gains come when data meets coaching and a plan. And this year's ACR, Rheumatic Disease Awareness Month, Rheum Moves, has a lot of resources for you and your patients, including infographics, exercise videos, and fact sheets that will make the first step easier. Thank you all for listening, downloading, subscribing to our show, and for rating us with 5 stars, or however many stars you think we deserve. You can find all of our show notes for this and all other episodes at acronair.org, on Apple Podcast, Spotify, and on your favorite podcast app. Until next time, keep moving with intention, because motion is lotion. And of course, stay healthy.